Welcome back to the Colander Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Colander, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Colander is here with us discussing his concierge practice and how to avoid heart attack and stroke and how to begin the reversal of artery disease. Now, Dr. Colander, we've been talking through these last segments about various blood tests. We covered the CT scan, which you said everybody should get. It's a very quick, easy test. And then you do the CIMT. You're the only one that does it in your office. Let's come back to the blood tests. And I am asking you, I think it's really pathetic that as a patient out there, or as part of the general public, we don't know, we just go in and stretch our arm out. Why are we not able to get these tests? Why do we not know about it?
Well, I agree with you, Anne-Marie. It is pathetic, and that's why we're doing the show, because you gave me the opportunity to come out here and educate people, and let's let people know what's out there, what they can get for themselves. They've got to challenge their doctor to do these, but you don't know what to get. I'm here to tell you. I actually tell my patients, don't watch the news, because the news is spinning stories in a way that is bad for their education. It gives them bad ideas. I tell them, don't watch the news. If you have a question, you got to ask me, because you're getting every bit of information spun the wrong way. And that's why we're doing the show, is so that you can hear a straighter version of it, no bias, other than you got to see me as a patient. But it's frustrating that people don't have access to better care in this day and age, especially given that heart attacks and strokes are still the #1 cause of death and disability in this country.
Now wait, let me just jump in here, because this is the first time I heard of ApoB as a test. And down here I'm looking on your list of other tests, the LPA test. What's that all about?
Well, LPA is actually very important, and LPA is called lipoprotein A. It's also referred to as Lp(a), and this is a lipid particle. And so we talk about good cholesterol and bad cholesterols. All these different cholesterols we talk about are actually the same cholesterol. What makes them different is they have different particles carrying them. Cholesterol is the same. When it goes from an HDL to an LDL, it doesn't go from good to bad cholesterol. It's the same cholesterol molecule. It changes particles. So LPA is a lipid particle that is just like an LDL, but it has an apolipoprotein A protein in it, along with the ApoB protein that all LDLs have. And this different protein changes the characteristics of the LDL and makes it much more inflammatory than an LDL particle is. So that now when you have this LPA particle getting involved in your artery, the level of inflammation is much higher. And there's many studies that correlate increased risk of heart attack, stroke, related to LPA levels. So the higher your LPA level is, the higher your risk. In fact, African Americans have higher LPA levels than other people.
And do they know that?
I'm telling you right now, so now
Wow.
you know. Again, unless you're seeing a doctor who's got the time and inclination to provide this level of care to their patients, there's no way for you to know, because every other doctor's practicing with blinders on. And again, they're in a system that's broken. They got to get out of the system. So reminder now that clots are what cause heart attacks and strokes, not blockages. So now, if you are a carrier of a high level of LPA, now you've got a particle in your bloodstream that increases inflammation of your body and your arteries, which we've already said creates plaque and causes plaque rupture, which leads to events. Not only does it do that, but it also changes the balance between clotting and not clotting. Your body's in this constant state of homeostasis, meaning balance, of clotting and not clotting. LPA turns the balance toward clotting. So now you're more likely to clot. And so now you're more likely to have vascular inflammation and thickened arteries and damaged and you're more likely to clot. So that combination is deadly.
Okay, let me just stop you here because one word that you said stuck out when you say a carrier. Are you implying that there's a genetic predisposition to have more of this LPA than
Exactly.
Okay, that's
LPA
important.
is a genetic marker for heart disease. So once you have LPA, you have it, and we're trying to learn. You're born with it. And I ask family members who have LPA, even if they're not in my practice, I say, get your kids all tested for LPA. Then the challenge is, what do they do with it? Because people that have elevated LPAs need a higher level attention that I need to give them, not their family doctor who just isn't tuned into all the stuff that I am. So their lifetime risk of event is higher. It is as high as 40%, but the average lifetime risk of an event from LPA is about 30%. And again, 30%.
Okay, wait a second. That's like those are staggering numbers.
Oh, it's horrible.
When you're talking about something that can be genetically passed on, and it's a definable number that you can get from a blood test, and that you can then warn your patients to have their children tested, and nobody out there knows what it is.
I know, it's kind of crazy. I mean it's
really pathetic.
Yeah, it really is. And so I make sure every single patient in my practice has an LPA. And actually women need 2 LPAs because LPA goes up after menopause. So for my younger patients that are not menopausal, I check it, and if they're close, if their LPAs are pushing the upper limits of normal, I make sure they get it again. Although I haven't been in this practice long enough to get there, but I'm advising them that in X number of years you need to get another LPA to see if you've crossed the threshold of higher risk.
Well, it's all about risk, isn't it, after all?
Identifying risk in an appropriate way is complicated, but attainable. You've got to come see me to do those things. And I want to circle back here to our CIMT, or carotid intima media thickness ultrasound. It's a simple ultrasound. It takes 15 minutes. It's non-invasive, and it is mostly done of the carotid arteries. If you're out there and you are thinking, oh, I had a carotid Doppler, which is not a CIMT, and my doctor said it's fine, it does not mean you're fine, because the resolution of a carotid Doppler is, it doesn't identify disease less than 50% blockage. Well, we say blockage isn't good, but no amount of plaque or heart disease is acceptable. Doesn't mean to say that we can make it go away, but none of it's acceptable. The system, meaning what doctors are looking for in the cardiologist, they're not taking action on plaque that isn't critical. So if you're 49%, you might hear that you're fine and that you're normal and don't worry about it, because the test isn't discerning whether you're 49% or 25% or 5. I want to know when my patients have a calcium score of 1. I want to know that they make plaque or not what the details of the score. I want to know that they make plaque, and then I want to know what their activity is by checking a CIMT. Again, call my office. We'll take care of you on the CIMT. It's attainable to get that.
Well, I think it's very important that all of this plays a part, and that as patients are entitled to know what's out there.
Absolutely.
Okay, well, unfortunately, we're out of time tonight, and that wraps it up for the Colander Medical Radio Show on News Talk 760 WJR, sponsored by Colander Medical and Bystander Response. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Colander for talking to us about taking charge of our health, being proactive, and avoiding both heart attack and stroke. For more information on today's show, or to learn more about Dr. Colander's practice, you can reach him directly at 248-737-0091. Again, that's 248-737-0091. We hope you enjoyed the show and that you become more informed about avoiding heart attack, stroke, and the devastating results of artery disease. And more importantly, what we can do to halt or reverse the process. Once again, reach out to Dr. Colander at 248-737-0091.